Welcome back, everybody. Today I'm talking about periods. What's normal and what's not. Your period is a vital sign. That means it's just as important as your blood pressure and other things that we measure at the doctor's office. It's one way of telling us how healthy your body is. So stay tuned so you can know what's normal, what's not, and what we need to know about. All right, welcome back. Today we are talking about periods. So your periods are a vital sign. That means they're vital. And if they're not happening normally, here's what it might mean. Now, you probably spend most of your life trying not to get pregnant. But there might come a time when you do want to get pregnant. And what your periods are like are one indication of what your future fertility might be. So let's talk about what's normal and what's not. First step, first periods. So it's normal for somebody to get their first period around the age of 12 to 13. It's okay if you're 11 or 14 though. Here's what's not normal, and we'd want you to check in with a doctor. If you haven't gotten your period by age 15, or if it's been 3 years since telarchy. Now, what the heck does that mean? That's when you first started to develop breasts. So if you've started breast development and it's been 3 years since then and no signs of a period, let your doctor know. And as always, remember, I've got references and resources in the show notes, so take a look at those when you're done watching. Second thing that you want to pay attention to, how long are your periods? Normal? Bleeding for 2 to 7 days. Not normal? Bleeding for more than 7 days. Cycle length. This is how long it is from the start of one cycle to the start of your next cycle. In other words, from the first day of one period until the next first day of your next period. That's considered one cycle. A normal cycle length is between 21 to 45 days. Now, it's true we often say every 28 days is what's considered normal, but there's wiggle room. What's not normal? Less than 20 days between cycles, so really frequent periods, or more than 45 days between cycles. And for sure, more than 90 days or 3 months between cycles. How much bleeding is normal? So a normal period, you would use about 3 to 6 pads or tampons a day. What's not normal? Having to change a pad or a tampon every 1 to 2 hours because you're bleeding so much. Okay, so now that I've told you what we consider normal and not normal, what could be causing all of these things? And there's a lot, which is why it's really important to check in with your doctor or healthcare provider. So in the very beginning of periods, when you're very young and getting your first few periods, your body's still maturing. I have a really complicated word for that called the hypothalamic pituitary ovarian axis, and it takes a while for those to all get in sync. So when you have your first period, you may not have another period for a few months, and that's normal. It's not normal if you've gone from having completely normal regular periods to all of a sudden not having normal periods, or if it hasn't regulated within the first few cycles of you getting your period. Other things that can cause abnormal cycles, so too many androgens, or what we typically call male hormones. You can see that in PCOS or polycystic ovarian syndrome, congenital adrenal hyperplasia, and some rare androgen secreting tumors. Again, rare. Here's some more reasons that your periods might be a little wacky, and they tend to be a little more common. Stress. Yes, stress. It can really mess with your system. Exercise, all of a sudden doing a lot more activity. Changes in weight, so either changes up or down. Eating disorders, for the same reason. Bleeding disorders, which is something that you can inherit, and it can make it hard for your blood to clot or coagulate, and so that's why you get heavy periods. Something called primary ovarian insufficiency. Think of it as kind of early menopause. Your ovaries don't work as well. Certain medications, pregnancy, I know, but we always have to rule that one out. Certain infections, so it's really important to let your doctor know if you're sexually active. Some growths in the uterus, like polyps or fibroids, which are benign, not cancerous tumors that grow in the uterus, can lead to some abnormal periods. Something called adenomyosis and cancer. But again, this is really rare when you're really young. So just to review again, when do you need to see your doctor? Here's a great table right here. And I'd like to add to this one too. You also should see your doctor if at any point in time your periods are so painful that you can't go to school or work because of them. That's not normal, and we can help. Now, what do we actually do when you come to the doctor and we talk to you? We're going to ask lots of questions. We want to know about your periods, what they've been like, any changes in your medical history. Are you on any medications? Has your weight changed? We just want to really get to the bottom of this, so it involves asking questions. We will do an exam, but we may or may not need to do a pelvic exam. We'll feel your thyroid, we'll check your blood pressure, we'll check your weight. Talk to your doctor if you have concerns about a pelvic exam. Oh, and if you're worried about going to the gyno for the first time, just click on this card up here. I've already talked about it. And I've talked about what your first exam might be like. Click on this card too. See, I got you covered. We may do some blood work to check for some hormone levels and some other things. We may or may not need to do an ultrasound. It really depends on what your specific symptoms are. So if your period falls into one of these categories, what we consider not normal, let us know. The sooner we can see you, the more we can help. And you don't need to be afraid. We'll help talk you through everything. If you've got more questions, drop them in the comments. And again, check out my references and resources in the show notes. I hope this topic has been helpful to you. Let me know what other ideas you have that you want me to cover. Go ahead and follow me on Instagram and TikTok at Dr. Jennifer Lincoln. And please be sure to like, subscribe, and hit the notification bell so you know when I post a new video. Have a great day and stay safe out there, everybody.